If you're new to Medicare, you might be surprised to learn that it gives you a variety of coverage choices. Understanding your options can help you choose the coverage that's right for you. We're here to help. Let's start with your Medicare coverage option. Original Medicare, which is provided by the federal government. Original Medicare includes Medicare Part A hospital insurance and Medicare Part B medical insurance. Most people don't pay a premium for Part A, while Part B coverage does come with a monthly premium. But there are two very important details about Original Medicare you should always keep in mind. 1, it doesn't cover the costs of prescription drugs. And 2, it doesn't cap the amount of money you spend out of pocket for medical expenses each year. If your costs go above what Original Medicare covers, you pay the difference in full, and that could take a big bite out of your savings. To help cover the cost of prescription drugs, you can add a Medicare Part D prescription drug plan offered by a private insurer to your Original Medicare coverage. And to help fill some of Original Medicare's coverage gaps, you can purchase Medicare Supplement insurance, which is also offered by private insurers and generally gives you the freedom to see any provider that accepts Medicare. Of course, Original Medicare isn't your one and only option for receiving Medicare benefits. You can also choose to enroll in Medicare Part C, commonly known as Medicare Advantage. Medicare Advantage plans are offered by private insurance companies that have a contract with the federal government. These plans typically offer you access to a network of providers, and they combine your Part A hospital, Part B medical, and often Part D prescription drug coverage into one plan. You continue to pay your Part B premium. Medicare Advantage plans typically include extra benefits like health and wellness, vision and dental care that aren't part of Original Medicare. Plus, they offer you predictable costs by limiting what you pay out of pocket for medical expenses each year, which could help protect your savings. So, to summarize, here are the 4 basic Medicare coverage options available to you. You can choose Original Medicare only, which is Medicare Part A hospital and Part B medical insurance provided by the federal government. You can add a Medicare Part D prescription drug plan from a private insurer to your Original Medicare coverage. You can also purchase a Medicare Supplement plan from a private insurer to help fill in the coverage gaps of Original Medicare. Or you can enroll in a Medicare Advantage plan that combines your Medicare Part A hospital, Part B medical, and often Part D prescription drug coverage into one plan with extra benefits. Which of these coverage options is right for you? That can depend on a number of different factors, such as your health, budget, medications, and lifestyle. Our licensed insurance agents are here to give you guidance and help you find the Medicare coverage that best fits your needs, so you can feel more confident and secure about the choices you make. New to Medicare? We know it might seem a little confusing. After all, up until now, you probably haven't given Medicare much thought. Fortunately, the right information and guidance can help clear things up a lot. Learning about Medicare's 4 basic parts is a great way to start. First, there's Medicare Part A, which is hospital insurance. It covers inpatient care at hospital and rehabilitation facilities, as well as skilled nursing facility, hospice, and home health care. Typically, you won't pay a premium for Medicare Part A. It's coverage most Americans have already earned. Next, there's Medicare Part B. This part of Medicare is medical insurance, and it covers things like doctor's services, hospital outpatient care, ambulance services, preventive services, and more. You do pay a monthly premium for Medicare Part B coverage. Usually it comes out of your Social Security check. Medicare Parts A and B are both provided by the federal government. Together, they're what's known as Original Medicare, but there are still 2 more very important Medicare parts to go. Let's skip ahead a letter to Medicare Part D, prescription drug coverage. Medicare Part D plans are offered by private insurance companies, and they only cover prescription drugs. You have the option to add a Part D plan to your Original Medicare coverage, while typically paying a monthly plan premium to the insurance company. That leaves us with Medicare Part C, or as it's more commonly known, Medicare Advantage. Like Part D, Medicare Advantage plans are offered by private insurance companies. They combine your Part A hospital, Part B medical, and often Part D prescription drug coverage into one plan. Plus, they usually include extra benefits like health and wellness that aren't part of Original Medicare. With Medicare Advantage, you continue to pay your Part B premium, and you may also pay a premium to the insurance company. There you have it, the 4 basic parts of Medicare. Now that you know what they are and what they cover, you can approach Medicare with more confidence and be ready to choose the coverage that's right for you. Enrolling in Medicare is a big deal. After all, Medicare gives you access to a world of healthcare coverage and benefits you've earned. To take full advantage of them, you need to enroll at the right time and in the right way. But before you do, it's helpful to know who is eligible for Medicare in the first place. Medicare is available to Americans age 65 or older. People under age 65 with certain disabilities, or those who have end-stage renal disease, ESRD, are also eligible to enroll. If you're like most people, you'll sign up for Medicare around the time you turn 65. This initial enrollment period begins 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months after that birthday. If you don't sign up for Medicare during this initial enrollment period, you may have to pay Medicare Part B or Part D late enrollment penalties. Plus, you could be missing out on coverage and benefits designed to help protect your health and finances. That's why it's generally a good idea to enroll in Medicare, and if you choose to, sign up for a Medicare Advantage or Part D prescription drug plan as soon as you can. If you happen to miss out on your initial enrollment period, don't worry, it's not the only time you can enroll in Medicare or a Medicare plan. There's also the annual enrollment period that takes place every year. Beginning October 15th and ending December 7th, the annual enrollment period is generally the time when you can join or switch Medicare Advantage or Part D plans, or go back to original Medicare. There's also a Medicare Advantage open enrollment period that begins January 1st and ends March 31st. During this time, if you're in a Medicare Advantage plan and want to change your coverage, you can switch to a different Medicare Advantage plan with or without drug coverage. You can also go back to original Medicare and, if needed, join a Part D prescription drug plan. Keep in mind, if you do make a switch, your new coverage will start the first day of the month after your new plan gets your request for coverage. Once your initial enrollment period is ended, you may also be able to sign up for a Medicare Advantage plan during a special enrollment period. These are typically reserved for times when certain events happen in your life, and each special enrollment period can have different rules depending on the circumstances. Reasons for a special enrollment period may include changing where you live, losing your current coverage, or if your plan changes its contract with Medicare, to name just a few. It's nice knowing that if something happens in your life that affects your coverage, you're likely to have options. And there you have it, the 4 basic enrollment periods for Medicare Advantage. Whichever one you're participating in, remember that the cost and benefits of the Medicare coverage options available to you can vary a great deal. So do yourself a favor by doing some homework ahead of time. Making a list that includes your doctors and hospitals, prescription drugs, and lifestyle and budget can help you understand your needs and narrow down your options, which will make it easier to enroll in the Medicare coverage that's right for you.